5 minutes of your time. I promise, and I'll be done. So I work with Sis Thabile at the National Department of Health, and the department has started a program called the Knowledge Hub, and it is an online tool that helps healthcare workers access available training and to access resources that are produced by the department. As you've been sitting here today, there's been information being circulated. You've been told about USB flash drives and websites. So what the department is trying to do is to just consolidate material and to have final copies of training, guidelines, policies, and what Sis Thabile always says is that if it's not signed, it is not final. So what's uploaded online, it's what's been approved and what's final. So what we're going to be doing moving forward from this session, from yesterday, today, and tomorrow, the forms that you completed for SkillSmart, will be using those to register you on the Knowledge Hub. So you will all receive a username and a password with a link to the space so that you can just log into the space, and your login will work as long as you're as long as you're working for the department or you are not using the system. So this basically is the landing page that you will get when you log in. And if you have a username and password, I've just logged in for the purposes of this discussion. We have set up at the moment a master trainer space. So this is a space for you to be able to access all the materials referred to today, all the guidelines, PowerPoint slides, any training tools. And what we've done as well is that there's a healthcare worker training version online. So that still is being worked on as revisions are basically being made. The space is very simple, doesn't require a help guide or any explanation, we hope. So what it is really is that it's setting up it's based on your agenda, it's setting up the training materials. So what you simply need to do is just log in, and you can simply download the materials onto your hard drive and print them if you're organizing a session. If there are any updates, should anything be picked up after this session, emails will be sent out to everybody on the mailing list to alert you to any new changes to the materials that's basically uploaded. And we hope that will basically minimize misinformation or people communicating about materials or data that's outdated. So as you can see, as an example, from the session yesterday, I had uploaded material, and the team that's working on the guideline flagged that there are updates that need to be made. So what we then do is to flag that this needs to be updated, or we actually even take it down until the time that we have a final copy, and then we basically upload it. We've separated this into, or categorized it into sections, so you can print out the pre and post. It's the same one that you used, and that's going to be the one that the clinicians will use as well. There's all the ART guidelines, so we've put in all the related materials to that part of the session. The PMTCT, the viral hepatitis. So as soon as we receive the final signed guidelines, that will be uploaded and be made available. Additionally, to training, we have uploaded training tools. Sis Thabile will be talking about that now in terms of how training should be cascaded on the province. So those are guides and templates that can help you. And we have also a space for all the other related policies and guidelines that when we're looking at this training, there might be other reference materials that you might need or you might need to make your colleagues aware of. From this session, as you're aware, that there's been a video shoot. So what we will be doing, working with the video team, is to then cut up the session for today into sizable chunks, so that should you require clarity on something to do with hepatitis C and you couldn't remember, you remember there was a question that asked, it will be categorized quite nicely for you to be able to go through it as a reference to be able to refer. And what we'll also be doing is just adding the guides and tips in the, I think it was in the earlier session where they help numbers and the systems that you can access for viral load. So we're hoping to make all of that available on this space. The tool that was discussed about third line support, that will be uploaded with guidance on when to use it and where to basically submit it. So we hope that this space will provide you with the information that you would need to make your difficult job a little bit easier without having to collate and run around and finding things. That is all in one space, and then you left with the difficult task of just cascading and doing the training. And lastly, on here, as you can see with the mobile app, so you can download this. It works on your cell phone. It works, so you don't need to be on a desktop. So any cell phone that's connected, or tablet, laptop, desktop that's connected to the internet, basically works on the space. Then the space for the healthcare worker, again, we've kind of kept it simple so that there is something like that visual thing that indicates that this is like what the training is. And the big thing, again, it's about using the same name for the training. So you won't come to the space and we use TLD training. If it's called Introduced Dolutegravir, it will be called that, so that everybody gets familiar with what training they've attended, so that people don't get confused, because we use different names to describe same training programs. For the healthcare worker, because they weren't here to hear about the background, and I'm sure you will be talking about the background, we thought it would be nice from a national level to have a video by Dr. Pinini that will indicate, just sets the scene as to what this is about, why we're doing it, how healthcare workers basically fit in here. They will do a pre-test. And the approach that we have used for this is case studies. So we're supplementing the face-to-face with this online, where if somebody's gone through the 2-day, or it might be 3 days for some provinces, this space is also available for them in the privacy of their own homes or in their office, that they can come in and they can just look at the case study just to reinforce what they've learned, or to even listen to those videos that were taken, or to download things that they might not have available. Then once they've gone through the case studies, and the case studies done in the same approach as the adult primary care. So the first example that we saw of Nondumiso, a lot of you will be familiar with Nondumiso in the APC guide. So we're using the same, so that we're not introducing new ways of doing things, even though that is online, that we're just maximizing the training that's currently happening and not reinventing the wheel, so that it's much easier for them for nurses to be able to follow. Then once they've gone through the case studies, they'll do a post-test, and all the results of this will then be made available at a national level, or a provincial level, and at a district level. A big part of the training as well is the communication to patient. I think you've just mentioned about how useful it is to be communicating. So anything that we think is useful as a job aid for a nurse to have available to download, it will then be made available under communication cards. Again, we've repeated the national guidelines that they would basically need. So as new tools are made available, as new training is made available, or sections of this training is available, it will be populated. So for those districts or provinces that would be using the online version, in the same way as you will be capturing on SkillSmart, you will just be forwarding to us a list of those clinicians that you want registered onto the Knowledge Hub. They will be registered, and Sis Tabile will talk about the tracking to ensure that you have the numbers of who has logged in online, because they said they will do the online, who has logged in and who has completed the training on the online version. So that is my short and sharp presentation. If there are no more questions, I'll hand over back to Sis Tabile.